programming for adults and students or children in our community. Those programs have changed a little bit as we are not able to do as many things in person as we would like. And we've reduced that a little bit as well. And then the Performing Arts Center, which right now is not running much at all, but we're keeping the equipment tuned up and those types of things in that area as well as using the Performing Arts Center directors' talents in any way that we can. So you can see one of the things that I'll mention with Community Ed Fund is similar to Special Education Fund that was changed a couple of years ago, and that it has to have a zero budget or it has to project a zero fund balance at the end of the year. And so you see zeros on the far right-hand side of that. If we were to accumulate a budget in that fund, then that would reduce our tax levy for the following year. Cooperative purchases is simply a fund right now. It basically runs two things. The Badger Conference expenses go through that, as well as, and I'm just going to forget the federal grants right now. Perhaps Leslie can help me out with that. I just lost the name of it. But Greg Granberg runs a vocational education federal grant through that with a cooperative of, I'm not even sure how many districts. I think it might be 6 or 7 at this point.
Capital sales, it's about $426,000 in the budget. Does that happen to be the schoolhouse?
Yes, it does. We just sold that a couple weeks ago. So that's, you're on the revenue side of that. So we just realized those revenues. Yep.
Very good. And where do we stand in terms of real estate ownership in that area?
You bet. We have one lot remaining. It's right next to the lot that we sold this last year. So there were actually 3 lots that we purchased. And so we have one lot remaining. We did decide this year to work with a builder rather than risk kind of what happened this last year. So we are working with a local builder, and the kids will be working on that job site, adhering to those safety requirements with that and our instructor.
Okay. And again, that is over off of Alpine Parkway, right? The new subdivision off of Alpine Parkway?
You are correct, yes.
All right, very good. In the fund summary that you have up on the screen right now, food service drew my attention, and it's showing $300,000 of year-to-date revenue and $955,000 of expenditures. Where does that $300,000 come from?
So that's actually a budget. It's not. We haven't brought that much money in yet. I would say that we've probably brought in over the summer around $50,000, somewhere in that neighborhood with our summer offerings. So that's just our best guess at where we were going to land. Now, keep in mind that projection was done probably about a month ago, before we had the knowledge that USDA had opened up everything to all of our 18 and under residents. Actually, even non-residents could get food from us as long as we know that they're 18 or less.
And so what that sounds like to me is it's going to cost us a fair amount more to deliver on that program. And so I'm reflecting back on the August 10th meeting where we had transferred from last year's budget about $1.5 million for COVID-related expenses. And of that $1.5 million, it was actually a little more than $1.5 million, I believe. $750,000 was targeted for food service.
I'm sorry. Go ahead.
So the 955 surprised me without question, because I had a bit to say about the 750 that we were already looking at, and to have it come back in at another $200,000 plus startled me. So sure. Tell me about that.
You bet, you bet. So let me suggest that the way you might want to look at is to compare the 750 to the 655 that we're bringing in from the other fund. Okay. So we've always knew that we were going to bring in some revenue into Fund 50. So this just basically at the time, about a month ago, we were anticipating that instead of $750,000 in transfer, as we worked through the numbers, we thought, okay, I think we got it down to 655. I will tell you that my hope is to, between now and the original budget, that we'll get that number down a little bit more based on what I mentioned before with USDA offering, basically paying us to offer food to 18 and younger residents or non-residents in the district. That is a program that is fairly profitable for us. Not as profitable if we were providing food service in a normal year, but much more profitable than if we were trying to charge people to basically sell our food.
So that $300,000 is reflective of the increase in dollars that we are going to be receiving from the USDA, as opposed to revenue that we're receiving from high school kids buying lunch in the lunch line.
Correct.
Is that right?
Yep. And what I would actually say is our 300, when we created this budget, was actually our best guess at how much we would make from federal and state sources, as well as people paying for those lunches, and breakfasts. So now that we don't have to actually charge our residents, I would say that number will be higher, quite a bit higher. I would guess it will be probably closer to the $500,000 mark, but it's hard for me to say because it's only for half a year. So we get the benefit of this situation at least until December 31st, and then we'll have to reassess it as well.
And so with that in mind, if we have a net benefit in that area, for instance, of a couple $100,000, can I expect that of the $1.5 million transfer we have out there, that transfer will result in less of it being used?
Yes, less of it being used for food service, and hopefully less of it being used altogether.
Okay.
Sure.
All right, I appreciate that. Let's see if there was anything else I had specifically. Yes, another item is the enrollment. I know we are coming up on Friday, the 18th, for third Friday, September enrollment counts. And I know we don't have those yet. And in some of the preparatory material that we have here, we were noticing that we're down about 22 students from where we anticipated a month or 6 weeks ago. And knowing that each student brings with that student about $8,200, the absence of $160,000, $70,000, $80,000 because of that reduction is significant. Do we have an idea, although we're not there, I understand Friday's the date, do we have an indication of where that number is? What are we expecting for that number on Friday?
So the number that's in the packet was our best guess, probably about, again, 4 weeks ago or so. I don't have any newer information at this point in time. My newest information that I can share with you, though, is in a call that I had with Madison area school business officials in Middleton, Sun Prairie, Monona Grove, McFarland. Everybody is expecting less enrollment. And for me to say that about Sun Prairie and Middleton is fairly significant because those are growing districts. So I don't know. We are starting, in fact, we had about an hour of calls today because not only is this a little bit more difficult because we started the year a few days later than normal, but in this world where we're doing online enrollments, it's just a different process. And so making sure that everybody's on the same page is a little bit more difficult. So I don't know exactly where we're going to be. And that's all I can really tell you at this point.
Dr. Bergstrom, do you have a sense? Do you have any other sense than what Andy has on where we're going to be come Friday? And I'm just being conscious of the fact that for every 10 kids, it's $80-some thousand, and the likelihood is our expense isn't going to go down, but our revenue may.
Well, originally, for instance, when the emergency order came out, we knew we had some people who were open enrolling out to other districts. And that certainly continued for a portion. And we also had some people come back. And we also had some people move in. So I do think that, we had more than anyone would want open enrolling into another district. But when I spoke with our counterparts in other parts of Dane County, we had significantly less than the other people I spoke to. So that part I consider to be really good news. As far as an exact number, I think we'll probably have to wait for Friday. But I have some good news to report related to our kids who are attending. So I'll get to that in a little while.
All right, very good.
And Tim, I might just give you a little bit more information quickly. The open enrollment amount that you're talking about, the $8,000, is absolutely accurate. Those are for open enrolled students, and that's why we reduced that number, because that has the biggest impact
Yes.
year one. The residents that we have that might be moving out of our district, for instance, that doesn't change as fast because there's a 3-year averaging that happens there. So the number is closer to $12,000 that we obtained for those students. But if you have to take it divided by 3 to have it impact in one particular year. So a little bit more complicated than just the 8,000. And actually the residents doesn't hurt us as much in 1 year as the open enrolled. The other thing I'll share with open enrolled is a little bit nuanced as well. Open resident students, it really matters, that third Friday number, because they have to attend either before or on that day and after that day if they didn't attend on that day. But open enrollment is prorated. So we are hoping that if a student does leave us and goes, for instance, to Evansville, if we can get to a point where they want to come back, then that amount of money comes back with them for the remainder of the year. So there's a plus side there.
You bet. And obviously, earlier in the meeting tonight, we heard of that at least one Evansville transfer, and that hurts. It does. So that's all I was curious about. So those are really the only questions I have at the moment. So thank you both for the information.
You bet.
Krista and Troy, you're on deck.
Thanks. Tim asked a few of my questions I had about food service, but I do have one more about that, Andy. With the food service program that we have now with the USDA, we are delivering meals. So where is that transportation cost allocated to? Is that allocated to food service or is that transportation?
No, it would be transport, since it's related to supporting food service, it'd be food service.
Okay. So then my question is, I do see that we have the same, a pretty, I guess the transportation budget then is my next question. Are we going to realize any savings there, or is that
that's a great,
based on previous years, or?
Yes, it is currently based on previous years, and I'll share with you. At one point in time, I was thinking that we might have some savings there, and we may. We will, quite honestly, for at least the first week of instruction, because we didn't provide transportation then. But as we gear up, if we gear up to multiple days of instruction, or I'm sorry, like an AM and PM situation, then we are almost running regular routes, if you would, because we're running the students in the elementary to school and home, and then we're running a second route, which could be looked at almost like high school routes of those students in and out. So very quickly, we will be basically spending very similar amounts of transportation if we get to that AM PM situation. So we chose not to reduce that budget at this point in time.
Okay, thank you. I just had a question about that, so that cleared that up. Then my next question is not such a huge revenue impact, but a 52% increase in insurance. Can you just share what that is from?
Yeah, so that is not health insurance or dental insurance.
Okay.
So make that real clear. That is property insurance, workers' comp insurance, liability insurance. Mostly it is property insurance.
Okay.
We just obviously have some more property on our district rolls, as well as the new school. That doesn't make up for all of that, but if you're familiar with the property insurance going on in the state of Wisconsin, actually I think it's a nationwide thing. There have been some significant losses from the insurance companies, and quite honestly, I don't know that they've been making as much money in the investment side of things, and so the rates have gone up significantly.
Okay, then my last question is just clarification about special ed fund. I noticed that the special education grant, has the 1.1 as the expense and the revenue. So are those grants designated? They have to be spent exactly on certain things associated with special ed? Is that?
Yeah. The majority of that is IDEA funding that Dr. Widensee manages. And then there's, I think there's another couple funds that are in there, grants that are in there. Well, but most of it's the federal IDEA. And then there's some categorical funding that we get through the state of education, that's not restricted for specific purposes, but it needs to be spent on, it needs to be spent so that you get the corresponding revenue that connects to it the following year. So it is and it isn't, but it has to be spent for you to get the categorical back.
Okay. Those were my questions. Thank you.
You bet.
Troy, and then Anna, you're next.
Okay, so Tim had asked my question about enrollment, but I guess I want to probe a little bit further, specifically on open enrollment. We have a decrease of 22 students in open enrollment out. Is that number pretty solid? I mean, knowing that we have to go through a paperwork process to approve that, are we solid on 22?
I believe that was solid a few weeks ago. Before, I'm trying to think here, at the timing of this, it was based on, like I said, 3-4 weeks ago. I think, as Dr. Bergstrom said, we've kind of had some ins and outs. I just don't know for sure where we landed on it. But we took the the more conservative approach at that time. It's just that we've had some more movement, specifically with Dane County doing what they've done and other counties not.
Okay.
So I'm sorry I can't give you a better answer. If you give me a couple weeks, I will be able to.
Yeah. And then I guess my next question is on the assessed value. Looking at the chart that you had provided with the history, that was very helpful. Thanks for including that. I noticed our estimate right now is an increase of 5%. I look at the last 4 years, and we've always been greater than 5% over the last 4 years. Anecdotally, to me, it seems like we would be on track to exceed that again this year. However, I agree with the conservative estimate on that. Can you maybe just speak to that, Andy, in terms of, I know you track this pretty closely, and knowing that if we exceed that budgeted value, that's a direct decrease in our mill rate, correct?
Absolutely. It doesn't change our spending authority, but it does change our mill rate. And you're absolutely right. I try not to be overly optimistic with that number, because the last thing I want to do is share with people a levy rate that then we can't obtain based on a number of factors. I will tell you, I did look at the data. What I have to look at until typically October 1st, when they certify this number, is I have to look at the individual taxing districts and look and see what's going on in their area. And it's preliminary data. And as I recall, I felt comfortable with 5. It could be 6, but I felt really comfortable with 5, trying to look at our biggest districts. Quite honestly, the hardest thing I have is, so I have to look at an entire taxing jurisdiction. So the one that's the toughest is Fitchburg, because Fitchburg has 3 different school districts in it, and it's not broken out for me. So I have to kind of look at that number and try to do an educated guess where the growth has been. And then something called TIF districts enter into that as well, which doesn't allow us to access the assessed value growth in those particular areas. So it's a little bit complicated, But I definitely did take a conservative approach, and my hope is that we do have 6% or so growth.
Okay, thank you for adding that commentary. Related to that, on our property tax line, on our projected revenues, our projected increase from last year's budget is 10.6% on the property tax line. How does that relate to that EAV number? And because I know it's not quite a direct, it's not a direct relationship. I guess what jumps out to me is that 10.6 number seems higher than it would be.
Yeah, and let me share with you why. So it has to do with the referendum back in 2018. And if I didn't mention that more in the agenda item, I should have. If you recall, we have an override question that was approved by the taxpayers, and that actually, I think, had a larger impact than the bonds. I think it was 2.1 million. Now we had to take 400,000 off because that was for the capital improvement projects that we've done over the last several years, and there was a 10-year non-recurring referendum that went away, and then we just moved it into that. It had to do with we're only limited to 2 questions, where in the past we've done 3 in these situations. So the real number that is impacting the levy is about $1.7 million in additional funding to basically run the new school. That includes staffing, fixed staffing for that building, as well as utilities, cleaning staff, all those different things were included in that. So you've got, one way to look at it would be the assessed values go up 5%, and then you have this number associated with new students that are kind of adding an impact to the levy, as well as the override question to get to that 10% impact.
That makes sense. So bottom line is that's really a one-time increase that's been approved by our taxpayers as part of the operational increase with FES. So that,
correct.
Yeah, that's all coming together now in my head. That makes sense.
Yep.
Let's see here, capital projects. So Fund 40, you mentioned that 250 for the connection to the muffin network. That's budgeted, but that's just basically going to be a carryover into the next
Yes,
year.
yes. We it has to do with E-rate funding. We will actually get some of that funding back. So we did it in stages to take advantage of E-rate funding. The consultant that we hired to help us with this process didn't think that it would be a smart idea to do both projects in one year, so they wanted to separate the two grant years.
Okay. And then food service in the 50 fund. Tim and Krista kind of hit on this already. I guess in my head, when I look at that 300,000 versus the 955, tell me if I'm thinking about this correctly, but if we increase our sale of lunches, we become more efficient in dollar for dollar in how we operate and create our income in that fund, right? So it's the more lunches we sell, the more income we get from USDA or paid lunches if we're talking about the latter part of the school year. But many of our expenses are constant. Mainly the labor expenses are going to be constant. So as we increase our sales, we become more efficient in that fund. Am I thinking about that correctly?
You absolutely are. That labor is being utilized to produce more revenue.
Okay. And then lastly, on fund number 80, we're decreasing our community ed programming budget, but we're increasing our pool funding. Can you just speak to, I mean, is that an actual transfer between those sub funds, or is it?
I guess you could look at it that way, and I might have misspoke before as I'm rethinking this a little bit. Our pool operations, because we're limiting the amount of revenue that we can bring in, because it's become less efficient, if you would. And so what I thought would be important is that our community ed levy not increase. So we approached Amy Miller and said, hey, what are you thinking? And she's like, well, I can't run as many programs because we can't be, a physical component here. So she figured out ways to reduce her expenditures so that we could get to a point where we had the same tax levy for community ed as we've had in the past. As we really didn't think that it would be less services and more tax levy didn't make sense. So we thought the best we could do is try to freeze that. Unfortunately, the pool is less efficient. It just cannot have as many members in it and bringing in as much revenue as we would. Even if we increase fees, we didn't think we could reach where we needed to be. The other component of that is we did have a carryover last year, I believe. And so you see that there's a $29 million amount of money left in the fund last year. That had to reduce the levy for this year. And so that there's an impact there as well.
And we would expect that, all other things being equal, if we get back to a normal year next year, that would kind of flip back where we'd have more income in the pool fund, and we could allocate that money back to community service offerings.
Absolutely.
Okay. And that's all I had for questions. Thank you.
You bet.
Anna, you're up, and then Kevin.
Thank you. I just have a couple of questions. Everyone's covered quite a few really good questions already. With regards to the equalization aid allocation, item number 1, obviously this budget is based on July 1st DPI projection. How confident are we, I guess, at this point with that projection, given the state of things at the just fiscally, financially? How confident are we with that?
I haven't heard anybody talking about reducing the equalization aid. Nobody's projecting that. It has an impact on the tax levy, obviously. So for legislators to mess with that number, they actually could be increasing the property taxes, which going into the election year is not something most would want to talk about. So I may have mentioned this in the past, if there is a shortfall, and I want to say that we've had some pretty good news over the last month or so, but if there is a shortfall, the common thought is that they would reduce our per pupil categorical aid, which is not paid until the spring. So we are basing this on current law right now. That revenue is in our budget at current law. And I would say that over the last month or so, I'm more confident that that number will not be reduced, but I feel very confident that equalization aid will not be reduced.
Okay, great. Well, that's good to hear.
Yeah.
And my next question is related to the 1.5 million that we've kind of earmarked for the COVID-19 expenses. I guess just a question for my own purposes, and maybe it was described when we discussed this. Does that take into account bringing back in-person learning at what reopening phase are we projecting those dollars to cover? Meaning, have we taken into account all of the measures that we feel might need to be taken to increase our in-person learning, or do we see additional expenses related to that are not already accounted for in the 1.5 million?
So what I would say is this: I would say there's kind of some moving targets in both the revenue and expense side. So if we were, let's just say that we were in person on January 5th or whenever we come back from winter break. Well, then food service would all of a sudden ramp up and we would have more revenue there. So we'd have less of a need to put money into helping food service. And then that would free up dollars that we could then use if we do need some more PPE type things. maintenance. If we need more face shields or we need more filters or something of that nature. So I feel pretty confident that we can kind of manage those dynamics as they come at us. We've taken a fairly conservative approach at how we've built the budget so that if we go in person, things get better.
Okay, okay, great. Those really were the only other questions I had besides things everyone has already kind of clarified. So thank you.
You bet.
And,
Thanks,
Heather,
Steve. Thanks for the
hi.
great presentation. Can you hear me?
Mhm.
Okay,
Can.
good. Thanks for the great presentation. Going through the first budgeting process and you taking us line by line was very helpful for me. There's been a lot of great questions asked. I was going to ask the question really related to the $1.5 million COVID line and get a refresher on that. I know we've talked about it a little bit in the past, but it seems like we're taking a conservative approach and there's still a lot to be determined about timing of getting back to school and when that happens, what that's going to look like and what it's going to cause on the expense side. So I don't really have any further questions and appreciate all the good questions already asked by my fellow board members.
Heather, you on? Going once. There's Heather. I see her here. Can't hear you though, Heather. Okay. Well, I will go on and ask my questions and we'll come back to Heather. Andy, I went back and took a look at the numbers we were looking at revenue when we were doing our staffing projections. And for the additional student revenue under the 3-year average, we were pretty conservative back then. We were estimating an equalized value cut. And so we were projecting about 283,000, for that line item. And you're projecting 294 now. So just for board members, we're even with the little fewer students than we had projected. What we were working with in terms of staffing and the decisions we made on this budget back in April, we're higher right now in the revenue side than we were then. So even though student stuff isn't pacing right now because of circumstances, from a planning perspective, I think we're where we were back then. And it'll be interesting to see what that open enrollment budget is. Andy, does the open enrollment numbers that you have given, does that include the numbers related to opening up increased spaces that we did on July 1?
That's a great question, Steve. After a while, this stuff all kind of bleeds together a little bit. I can find out for you. I think so, but I'm not positive. I think it was based on actuals at that point in time, and I'm not sure we had accepted people yet.
Yeah, just so the board knows, the board votes on the final budget in October. We just need this to go to the preliminary. Andy, I want to thank you, before I'm finished with the rest of my questions, because folks, we just opened a new school, and normally at the beginning of the year for our business manager, that's an event in and of itself that causes major disruption, trying to get that. And Andy's done that. Plus he's putting together a budget that has a tons more variables than normal and trying to focus. That's just been amazing. So even to get the numbers as close to firm as you've done now is really commendable. And, people just got to be patient as we play with some of this stuff that's really outside of your control.
I appreciate that.
Yeah, I can imagine. I think it was Troy talked about the impact of the construction referendum question and the override referendum question. And am I correct that this is the first year that our budget will have the impact of both of those on the tax levy?
Yeah, the impact of the bonds happened way back actually in 2018, but this year is the first year of the override. So both are in
Why
this
don't
year.
you, could you on the share slide go to the mill rate slide just so people understand this?
I didn't make a slide with the mill rate. If you give me a minute, I can pull it
Here,
up.
no, I got it. Well, we can do it this way. I'm gonna pull it here. In 2017, before the construction referendum went online, our mill rate was 11.56. Okay, and we're projecting an 11.52 this year. So we're going to be 4 cents down per thousand, even after adding the construction and the override referendum, which indicates me that the new growth in this district, a lot of which is attributable to the reasons why we incurred those extra costs, have really started to fund that additional cost for both the override and for the construction bonds. Do you agree with that?
Yeah, absolutely.
Okay. Yeah. So one of the things I'd like to track over the next couple of years when we settle down is try to spin that out a little bit more and see if we can look at the proposition was when we went into those referendums that over a period of time, the additional growth attributed to the growth that's generating the need for the new buildings will pay for those new buildings and the operational costs. To me, the fact that our mill rate's going down 4 cents, even after we've added those two, kind of led some credence to that. So, on the Fund 80 stuff, it looks like what we're doing is using some of our fund balance to match expenses and revenues right now as best we can. Is that right?
Yeah, and that's actually, to some degree required with the new community ed.
That's right. Yeah.
Yep.
Yep. And I'll let people know, I'll give them a little sneak preview. Andy made the statement that we're not having much going on in our PAC and we're still funding our PAC director. He's really busy helping with all the music folks. And there's a little sneak preview. You'll be seeing some product of Nate Mendel and his collaboration with the music team shortly. And maybe a board member will be involved in that. So, but he's really busy assisting in the delivery of online curriculum through the music programs and doing that because he's really a talented guy. So even though he's not working inside the PAC, he's working full-time in delivering curriculum. So the food service, just to hit that one more time, Andy, what I understand was when we were talking about how would the $1.5 million excess from last year that we put into a specifically designated balance this year would be used was that we had estimated maybe 750 would need to close the gaps between revenue and expenses. Okay, because of the new program, we've got that down to 650, which is kind of better case scenario than we were presented when we did the 1.5. Is that right? Am I looking at that right?
Yeah. And my hope is that we can do even a little bit better by the time we move to the original budget.
Right. And that's because the 300 is a guess in terms of revenue. The 955 is fixed costs, assuming that we're continuing to employ all food service workers, correct?
Absolutely.
Correct. And so the board's direction was to utilize that 1.5, we needed to use that for meaningful expenses. And what I'm hearing through this is that because we're now working those kitchens, closer to full time, that we need more of those to do the same type of food service prep that they've done before.
That and transportation delivery, those types of processes. Yep.
If you could in the next couple of weeks, just let us know what type of work in terms of non-food service work the food service workers are doing. Some of it seems to be related to food service in terms of getting that food to our students. But that would, I think, just help the board, in terms of due diligence on the meaningful work phase of that.
Okay.
Other than that, I would just note that, we talked a little bit about the special ed expenditures, and we spend about 8.8 million, if I looked at that right, and we get 3.4 back from the government. That's maybe a third of what we spend. And the government promise back then was 2/3. So, over the years under the formula, the state has not lived up to its one, and federal government has not lived up to their promise of 2/3. We're funding 1/3 of their obligation on that. So.
Yeah, and give a little credit. This last budget actually did increase a little bit. So, but it's the first increase probably in probably my 20 years here. So they've got a long ways to go.
Andy, thanks for a really good presentation. Heather, do you have any questions? I see you're back live. You're muted.
I'm here. No, I just have had technology issues. I heard the whole presentation, but my camera wouldn't work. So, but thank you, Andy. That was really helpful. I guess the advantage of going last is that everybody has asked really amazing questions. So I think I am all set for now, but wanted to thank Andy for the time and all of the detail. It was really helpful.
Great. And Heather and Kevin and anybody else, as in 2 weeks, we present this to the electorate just to approve the levy, but our work on the budget won't be done until October. So if you want to do a review or anything, we can set up a time with Andy where we'll do that. And I'd like to be part of that too. And that's open to any board members. So just send me an email if you'd like to have another go through of this so you understand it before we get to October. All right. Did any of the questions that anybody asked generate any questions from any other board member? Okay, I don't see anybody, and I've got you all on the tile, so I don't see any of that. So I need a motion to approve the 2020-21 budget, tentative budget, preliminary budget as recommended, and for presentation at the annual meeting.
This is Troy. I'll make a motion to approve the 2020-21 preliminary budget as presented.
Is there a second to that motion?
I'll second that motion.
Tim's got the second. Okay, any discussion? And just put thumbs up if you want to say anything. All right, call the roll.
Mr. Pankratz,
Yes.
Mr. LeBrun,
Yes.
Ms. Garrison,
Yes.
Mr. Maring,
Yes.
Ms. Flanagan,
Yes.
Ms. Bijak,
Yes.
Mr. Zach.
Yes, preliminary budget is approved and it can be published in time to have that for our annual meeting in 2 weeks. Thank you, Andy. And thanks to your team. Give your team thanks for helping put that together.
I will.
Thanks,
absolutely.
Andy.
You bet.
Okay, that takes us to agenda section D, discussion items, committee reports, anything from policy, Anna?
Nothing to report at this time.
Vision, where am I at? Troy.
Nothing to report. We have not met in the past couple weeks.
Okay, takes us to information items E, opening of school 2021, and we're off. That was great to get started and got done with planning and actual working. And Dr. Bergstrom, this is your time to update the board. And then when Leslie's done, if anybody has any questions about that or any comments, we'll go through the board to do that, to give some feedback to Leslie. Okay, good. Go ahead, Dr. Bergstrom.
All right, I'm going to start off by showing everybody. I'm going to open this up a little bit. The video that we sent home to our kids. And there's a reason for it. I'll explain that at the end.
Hello, Oregon School District students and families. Our school year starts tomorrow. Starting the school year in a pandemic will look and feel different for everyone. But our teachers and our staff have been preparing all summer, and we can't wait to begin. But before we do, we wanted to take a moment to send you a special message on behalf of the entire Oregon School District. Because we care about you. Because we care about you.
We've redesigned learning methods, formats, and schedules.
We've created extra help and safety procedures. And we have worked to ensure you have access to resources and helpful. Because we care about you. We want you to know that whether you're learning online or in in-person small groups, we commit to upholding our values.
And delivering high-quality instruction and experiences to each and every student every day.
In a way that keeps our school community safe. Because we care about you. We have created a thoughtful and careful reopening plan. Because we care about you.
We will start slow to go fast.
We will take time to connect and build relationships.
So when it is safe to phase in, we are ready. Because we care about you.
We know that our kindness and compassion toward one another will be unmatched this year.
And we know no matter where we start,
Will not determine where we finish.
We are all in this together, and together we are going to achieve amazing things.
Because we care so much about you.
Because we care about you so much.
Because we care about you.
Because we care about you.
Can't wait to see you tomorrow.
Okay, now I'm going to go to our regular presentation, and I'll explain to you why I wanted you to see that first. There we go. So we sent this out to our staff and families, and one of the things that our students and families, and one of the things I wanted to bring up is that particular line, and it was the line that Mike Carr said in the video, and that's where we are starting is not where we will end up. And I think that's a really important thing to remember, that we are starting, and this is the second week of instruction, but this is not how we will spend our entire year. We're going to find a way forward, and that our slow start hopefully will end up allowing us to spend more time in person. So a lot has happened in this first week, and there's a lot to talk about, and there's a lot to celebrate. And we feel good about how week one has started for our students. So that's really what we wanted to start to talk about first, is what strategies are being employed right now for supporting our kids. And so I know from the last board meeting that our board members were very interested and wanted regular updates on issues related to engagement and truancy, because we wanted to make sure that we're bringing all of our kids along with us and we weren't losing anybody in this process. Consequently, our principals would have already done this, but we're being hyper aware, and they have sent us at the district office summaries of week one and attendance. How many students did not log in each day, and if they didn't log in, what was the follow-up? So we have some really good record keeping in that, and the highest number in any one day was 16 students. But that actually went down to only 5 because 11 of those 16 watched the recorded lesson later. So we do have systems in place now to be able to check when students are watching something, so that if they have a technical difficulty or they have an odd schedule for the day, we're able to track not only when they're present for their live learning, but if they do miss it, if they're able to access it later. And so we have a system of attendance ready to go. We're utilizing it to make sure that we're understanding the needs of every one of our students. So once somebody doesn't log in, once we're worried, where are they? What are we going to do? There's a number of pieces we have to figure out how to support them, basically. So we know that there are technical issues. So we have our online, our tech support line. We have online resources such as videos on how to use some of the features, because it isn't easy for everybody and it's not all intuitive. And so we really do need to provide those supports. And we're also in the process of putting out a needs assessment, so we can better understand what type of skills our students and our families, for that matter, need to be able to fully access everything that we're offering. The other issue is we really talk about the family support and engagement. And that is, what type of resources do we need for our families? What type of partnerships do we need to employ? And are we reaching out to parents too? So that's technical support is one piece. Family support and engagement is another. The other piece is social emotional support. Of course, the foundational piece of where we are right now, the foundation is build relationships, get to know people, begin to build trust. Those are the things that the learning is built upon. So we know that and we're prioritizing that. But we also have done things like student well-being checks. Okay, this person didn't log in and nobody answered their phone. So I'm going to go over, knock on the door, and stand outside so that I'm, being physically distanced, but at the same time, just making sure that you are okay. So we had a couple of those visits too. And then teachers are making incredible connections with our students, as are our student services staff. And we know who a lot of our families are who might need some extra support, so we've reached out to them. But in addition, we just sent out a well-being survey to parents, basically asking our parents, have you noticed changes that concern you? Would you like someone from student services to contact you? Would you like someone from student services to reach out to your child? And that survey, I think there were 479 responses thus far, and the vast, vast majority are no, you don't need to reach out. They're just people who are filling out the survey. No, my student's fine. No, I don't need extra support. However, there are students at every building where a family has put in the survey, yes, call me. I want to talk to you about this. So we're ensuring by reaching out in multiple ways, phone calls, text messages, home visits, surveys, that we're making sure that we know what's happening with our kids. And we're paying attention and we're listening to our families and we're listening to our students. Oh, one more thing that I want to add to that, and that's just to give you a little bit more information related to the food service piece. Because honestly, the food that people are able to pick up or have delivered is really another level of family support. Because we know that there are many families who can come and pick up the food, and that works out well for their schedule, and that's wonderful. But we also know that there are a lot of students, particularly older students, who are at home while a parent or caregiver is at work. And so being able to deliver the food to students, regardless of financial need, I think is a really important service we can provide families in this really difficult time. And just to show you how well utilized that was for week one, just week one, 2,925 meals were delivered and 842 were picked up through the grab and go option. So as I said, that's pretty extraordinary. And then if you want to think about how our food service staff are being utilized, I have some information for you and I can certainly give you more later. But we have a large number or a kitchen full of people who are making meals. And then we have another crew delivering meals. And then we had a resignation and a retirement or a couple of retirements. We have 4 who were assigned to be bus supervisors. But we've also had some food service staff move into paraprofessional positions that were vacated for a number of reasons. So instead, food service members have slid into those roles. So we're able to ensure that there is definitely meaningful work for the people who want to remain employed by the school district. So that's some of our good news. I think our kids were extremely responsive related to beginning their first week of school. And I'll talk more later in the superintendent's report about the fact that today was the first day we had our K2s, a small group of K2s in school. The classrooms were really small, from 4 to 6 kids, but they were here for 2 hours, and it was exciting to have them in the building. But now I'll transition into what is our thought related to planning as we move forward and build on this strong foundation. Well, as you know, we've been talking about these guiding principles in all of our discussions. It's become a constant in our presentations because we have remained constant to these principles. Equity is at the center, just like the whole child emphasis and all of the pieces that are extremely important to us. And that's why we've had a lot of social emotional learning happening in the first couple of weeks. We're trying to set the foundation for high quality instruction. But what's really important to note is that we've had to have a lot of time spent thinking about flexibility and adaptability, as well as health and safety. And I'll show you in just a second just exactly how flexible and adaptable we've had to be as a system. So I think it was July 27th when we first presented to the board about our phased reopening plan. And then on August 21st is when Public Health issued the emergency order number 9. And so that gave us firm metrics for school reopening at different grade levels. And it also made 3 to 12 a mandatory virtual start. It also, and this is important to note, originally our phased restart was for 4K through grade 4. We were planning on bringing in for small groups. But with the emergency order number 9, that was made into 4K through grade 2, because those that's what was allowed, because the metric was met for K through 2 on August 18th. So right away, as soon as that emergency order was issued, we knew K2 was allowable. And then we moved to August 31st, because that's when we learned that we had the ability to offer the free meal waiver extension. It was an extension from what we were doing in the spring, and it's going through December of 2020, or hopefully not earlier than that, but it is dependent on funding. And this really changed, and it required significant shifts in food service, because they, in a matter of a week, ramped up their ability to be, and to the point where they were able to serve 3,700 meals, serve and deliver 3,700 meals in week 1. And then on September 2nd, we received the emergency order number 9 amendment, which allows in-person instruction for students with disabilities and or an IEP who, due to unique needs, requires some component of in-person instruction. So you can see these changes continue to roll, and we have to be flexible and adaptable to roll with them. And then on September 10th, so last week, Thursday, later in the evening, is when the Wisconsin Supreme Court put together the temporary injunction on related to Public Health of Madison-Dane County's ability or authority to close schools. Their judgment, the injunction, was on that. It wasn't on the metrics that they were using. And it did not change any information coming from Public Health. It just made it so that it was no longer an order. However, in a meeting the next day with Public Health, they stressed that it was just as important to follow the guidance as it had ever been. It just simply wasn't at that point in time an enforceable order. So I've spoken about these metrics, so I want to give you a little bit of information on what these metrics are about. For kindergarten through grade 2, and notice it doesn't say 4K, because 4K is connected to the daycare metrics. However, Ms. Amelong, the 4K principal, has been working to align 4K with the kindergarten through grade 2. So we have approached it somewhat differently. But the target metric, according to Public Health, was a 14-day average of 54 cases per day or less in Dane County, sustained for over 4 consecutive weeks. And the source for that information, because there were a lot of questions from districts and from parents related to where did this information come from? So in general, in my conversations with Public Health, they said that to inform the establishment of these metrics and to inform their guidance, that they leaned on reports from other parts of the country, similar school reopening reports from Minnesota, Massachusetts, Michigan, et cetera, in addition to, of course, CDC guidance. But they leaned very heavily on the kindergarten through grade 2 metric on 3 different pieces: Harvard's School of Public Health, their path to zero, and schools achieving pandemic resilient teaching and learning spaces. So that was one source that contributed to the establishment of the 54 cases per day for a 14-day average for 4 weeks, in addition to COVID Local and COVID Act Now. So they used three pieces of information that they said they leaned on particularly heavily in the establishment of that metric. For grades 3 through 5, and related to that metric, it is considered close to the moderate range in the Harvard's guide. That is actually linked on the public health website, so it's very accessible. For grades 3 through 5, which is 39 cases per day on a 14-day average for 4 consecutive weeks, that is taken from the DHS activity tracker, and it's connected to the burden related to moderately high. And we have not met that yet, and I'll show you a little bit about where our 14-day averages have been thus far. And then for grade 6 through 12, the 19 cases on a 14-day average is actually from the DHS activity tracker under the burden of moderate. Now, people are often asking, why are they different? And I think that's a really excellent question. And the way public health has described it, and they have the research that they're using to make some of these determinations listed at the bottom, just like a bibliography. And that is, right now, research tells us there's limited transmission in younger children, lower susceptibility, and a lower disease severity. Consequently, through that, they said we are starting this phasing in portion for our county with our youngest students and working up from there. Now, I know that there was some discussion related to, I think in one of the letters that was put forward today, related to mortality rates, because for young people, the mortality rates are very low. And that's a great thing, because the health and safety of our students is an absolutely critical factor in all decision making. But we also know from research that our older students in particular, 11 and above, sometimes it's indicated 12 and above, it depends on the study that you're looking at, tend to transmit the virus as much as adults. Consequently, there's a higher standard of community transmission before we gather them in large groups. And and they may not, thank goodness, have a high mortality rate for having COVID, as I spoke with Dr. Tempty from the Orchards Project today. And what he said was very concise. He said most young people sail through it. Not saying it's easy, not saying they're sick or not sick. He said, but some don't. And I think that's an important thing for us to remember, is that we don't know the long-term effects of the virus on anyone, no matter the age range. And we also know that even if our students aren't necessarily getting extremely sick, thankfully, with the virus, they are potentially taking it home. And they are exposing people who may be more vulnerable than they are. And maybe that's not even the caretakers within their home, but then they may also, the caretaker may then be taking it to somebody who is more vulnerable. So it really is about community transmission and making sure that we're making choices that are responsible for keeping our students safe, first and foremost, our staff safe, and also ensuring that we're contributing to declining transmission rates within the community. So then, if you look at, this is a really big piece, because I received a lot of concerned emails from parents this weekend about this piece. It's really important to make this point, because if you take a look at the 14-day averages, starting from the beginning of August till now, you'll see that on September 10th, there is a significant jump, right? And of course, those are 65% of those cases, I believe, are due to the UW campus. And so, of course, many of the Dane County superintendents were anticipating that there may indeed be an increase in cases after our college students came back to campus. And so we asked back in mid-August, we said, if it goes above 54 at a 14-day average, does that automatically mean that K2 then must be closed? And so they told us at the time that no, there are other factors that contribute to it. It's not only that positive case metric. So once this happened, meaning once there was a spike in cases that is continuing, the biggest concern I think that we received from parents was, why in the world would you start in-person instruction for K2? And why would you consider potentially increasing it in October when cases are actually going up? Well, the response that's here comes from the September 10th blog post from Public Health related to K2 in particular. Or actually, this quote might be from the September 3rd, but it was repeated again in the September 10th blog post. So they're making this statement on multiple occasions. And that is that at this point in time, they do not have plans to recommend that K2 is no longer in person. Now, that may happen. And they will certainly, as I've stated before, I'm meeting with a representative from Public Health at least twice a week, but that doesn't mean I'm not going on their website every single morning. And I also expect that if they were to make a decision about K2 no longer being open, they would let us know right away. But as of right now, Public Health is still allowing K2 instruction. And so a lot of people were very concerned in emails this weekend that by allowing K2 or by considering additional K2 time in October, that we were going against public health recommendations. But I just want to make the case that right now they're saying that this is still okay. And as you can see from the quote, they're saying that they're considering the number of positive cases in addition to the extent of exposure, contact tracing capacity, and that at this moment, there's little evidence of spillover in other parts of the community. So we will have at least 3 weeks before we think about, before we have plans, if public health allows, to increase K2 instruction the week of October 5th. That gives us 3 weeks to have these small group instructional times with our students where they're only in school for 2 hours at a time, once a week. They're learning, we're helping them to learn how to keep their mask on, to wash their hands, to do the 6 feet of physical distancing. We're helping them understand all those pieces so that if public health still allows K2 instruction, we are ready to increase the time. But we won't if we don't have the go-ahead from public health. But we really need to plan a few weeks into the future because there are a lot of logistical pieces connected to an increase in time. And that's also why we asked our parents of students in grades 3 through 5 to indicate if they would like to be in an AM or a PM cohort, not because there is a date at this point in time for that. Hopefully it will be soon, but we don't have a date yet. However, we want to be prepared so that when we get our numbers are where they need to be, we can start right away. So we're really trying to be prepared. And I think sometimes in our effort to be prepared, we make people concerned that perhaps we're rushing the process. When in fact, the process thankfully has stayed the same from the beginning. Another important component to remember is that public health is also asking schools to maintain 6 feet of distancing to ensure face coverings and all of those things that as adults we are also doing. And so there's implications for that in the sense that our physical classrooms, we can't have a full classroom of students and maintain 6 feet of physical distancing. So that is one of the reasons that we think it's appropriate for students to be divided into cohorts. It also makes contact tracing much easier because we know then who was in the room, and if they're more than 6 feet apart and they have been able to stay that way, although I'm not sure if with K2 we'll always be able to make them stay that way, but we'll at least know how many kids were in the room, who was sitting nearby, and we have much more control of that in a smaller group than we would a larger. Now, the teaching staff, that's where it gets complicated, because even when you have enough rooms and you can spread out, let's say elementary students spread out into the high school, for example, when the metrics are met, it's still about the number of people that we have to do the teaching. So there are a lot of complicated logistics, and that's why when we are able to bring students back, either for more time or for the first time, that we'll probably be bringing them back in a cohort model. If we do it too soon, I think that the concern is we'll see a lot of what's happening in other schools where you know, there are a lot of cases and there are a lot of quarantines, and eventually whole schools are shut down. So we're really hoping in this situation that starting slow does not mean that, you know, means that we'll be able to end up at a good place eventually. So in order to reassure people that the plan that we have discussed for our K2 students is indeed the plan we originally discussed, we took a screenshot from the presentation that was on posted on July 30th. So our plan all along has been to, if public metrics allow it to happen, to increase in-person instruction for our youngest students October 5th. Once again, it won't happen if public health says it's not safe for us to do. But right now, we still have the thumbs up and we can begin. The things that have shifted since the end of July presentation is 9/14 is when we actually began, or excuse me, sorry, we decided to begin instruction on online instruction on September 8th and the small groups on September 14th as opposed to September 8th. So we gave ourselves just a 1 week buffer zone there. And then we had to realign our grade bands because our original plan was for our Oregon phased restart students to start school and have those small group cohorts 4K through grade 4. But with the public health recommendation breaking it down to K2s and then 3-5s, we made an adjustment based on that. Another piece that we know has been discussed quite a bit is that there was some confusion that perhaps you know, all of our youngest students were going online and Oregon online, or we're phased restart and Oregon online was going away. And that is absolutely not the case. We're absolutely committed to giving families that choice of being able to be online if they want to. And we probably don't talk about it as much because there aren't as many logistical pieces to put together as there are with a phased restart. So for example, today at Prairie View and Netherwood, when our littlest learners were arriving, when I say littlest, I mean really truly kindergartners were coming to school for physically coming to school for the very first time. Although I was able to witness an adorable interaction when a teacher outside said to a brand new kindergartner who was just walking away from mom for the first time, and the school adult said, "Welcome to your first day of kindergarten." And she said, "This isn't my first day. I started last week." So it was good to hear that they thought of their online experience in that manner. But when I was watching the kids come in, there were staff members, many thanks to our teachers, our staff, our administrators. There were staff members probably about every 20 feet in a yellow vest, guiding kids along to the next person in a yellow vest, a train of people taking them all the way to the door where they went in. And so just looking at all of the people who had to be outside to ensure that the little ones who were getting dropped off either by a family vehicle or a bus, how they were making it to the right door in the building and then to their teacher's room while maintaining physical distancing, while being made to feel welcomed and cared for. It's a complicated process full of a lot of logistics. So that's probably why, if you're an Oregon Online family and you think you're hearing a little too much about Oregon phased restart, that's one of the reasons. There are a lot of logistical components. So for phased restart, you'll see that the 4K, we're planning for expanded instruction beginning in October, unless public health guidance changes and they tell us that this is not a good idea. The grades 3 through 5 teams are planning for in-person instruction. They're getting it ready to go so that when we meet the metric, we can move full steam ahead. And then we're also looking at all the possibilities for safe in-person instruction for grades 6 through 12. Because of course we want our students in grades 6 through 12 to be able to be in school also. That's what everybody wants. And we know that there's a higher standard until to make that happen at this point. And we also know that they're much more adept at accessing online learning than a 5, 6, or 7-year-old is. So that is one of the many reasons why our students are tiered by grade bands. So we're definitely watching what's happening in other areas for good and for bad, because we know that there are other schools who have opened and who are currently struggling. And we also know that there are schools who have opened and things are going well. So we want to be able to learn from all of that. And as I mentioned previously, I had a very nice phone conversation with Dr. Tempty from the Orchards Project. And Dr. Tempty is also on the chancellor's team of experts that meets with the university chancellor on a daily basis. And thankfully, he's a well-known Oregon resident who, through the Orchards Project, is known to many of us because of his specialty on influenza and the spread of influenza. So he and I had a good conversation today where we talked about the public health metrics and we talked about our phased plan, and in particular, our K2 plan right now, because we know there's a lot of families who are concerned that we are rushing it. And Dr. Tempty gave me permission to quote him as stating that he sees our plan right now as being sound and reasonable. And he spoke about always remembering that there is never an elimination of risk, and we all know that. We're not going to be able to make it so that there's absolutely no risk in our schools for anything that happens. That simply isn't possible. But it's about the minimization of risk. And he reminded me that anytime you're bringing individuals together, you're increasing the likelihood of transmission. However, in our discussion related to our plan, as I stated previously, he did refer to it as sound and reasonable. And he also reminded me that there is no one right way to do this, and that very good, thoughtful, well-intentioned people can have very different ideas on how to go about keeping our students safe. So, as I mentioned previously, our next phases will be about Jackie Emlong will give information to our 4K parents regarding what's coming for them should public health metrics allow. Our kindergarten through grade 2, we're talking about half days, 7:50 to 10:30, and then 12:10 to 2:50. And we hope, and that's for 4 days a week, and we hope to be able to start that October 5th. But as I said, it's all dependent on how the next few weeks go and the guidance we get from public health. And we won't do it if we don't have the support of public health. We chose half days, and I know that was something that some people said, what? I thought you were thinking about all day cohorts. Well, I want to make sure you know the process that we use to come to this conclusion. First, as always, you look at what neighbors are doing because we always try to learn from one another. And that's an approach used in a couple of our other districts who started, our Dane County districts, who started K2 instruction earlier than we did. But you learn from that, but you don't necessarily do the same thing. Although I have to say, Dane County districts overall are quite united on adhering to public health. However, in addition to looking at what others are doing, we also listed the options, and we had what we were referring to as a super leadership team, meaning that there were representatives from grades K through 2 from every one of the schools that offers those grades coming together with principals to examine the possibilities. Because in this situation, we really feel that what will result in the best learning is one of the most important factors that we can consider in deciding how we're going to go about these sessions of more instructional time for K2. And the teachers who were a part of it felt very strongly that the best educational outcomes were going to come from seeing the children more frequently. That in a Monday, Tuesday, Thursday, Friday cohort option, there could potentially be 5 days in between seeing students or seeing cohorts of students. And so they thought if they were able to see all of their kids 4 days a week, that's going to lead to better learning. And of course, some families had some really excellent questions about that. And one of the first questions was, how are you going to be able to clean the classrooms in between a cohort that ends at 10:30 and a cohort that begins at 12:10? Well, one of the things that's important to note is that the classrooms under these restrictions look a little bit different. They don't have all the stuff out that they normally have, because really students will have their own materials that they are working with, but there won't be as many things around them because we really can't necessarily clean every game or every book or everything that we would love to have our students be able to do. And instead they'll have their own set of math manipulatives and some of their own books in their bins and that sort of thing. So we won't have a lot of those extra things to clean. It'll be more about ensuring that high contact areas are cleaned between sessions in the classroom and on the buses. And we've been assured that that is an absolutely, that we can do it. That's not a problem. And so for selecting AM or PM, families were allowed to put in their preference, and we'll do everything we can to give people their preference, but we also know we have to balance out cohort and class sizes. We want to make sure we're keeping them very small. So right now the students are in a pod of 4 to 6, and if we increase their instructional time, they would be in a pod of probably 8 to 12. So it would increase just a little bit like that. We're also looking at transportation needs, and we're also trying to make sure that siblings are together and that they're attending the same half-day sessions, because we know that all of this is extremely complicated for families. And we had the excellent suggestion of perhaps trying to put some students who are already together at daycare centers like ASC, Karate America, etc. Allow them to come on the same day too. So we're going to try to work in all of that so that we can accommodate as many suggestions and as many needs as we possibly can. So finally, as you know, there are many factors at play as we navigate through the beginning of the school year while living in a pandemic. And honestly, while living in a county that is listed as a high rate of transmission on the DHS activity tracker, and then living in a state that's currently increasing in numbers as far as numbers positive. There are a lot of competing factors and a lot of competing needs and desires. And it's challenging to balance all of that. And that's really why we rely heavily on our guiding principles. What do we know to be ultimately important? And honestly, we rely very much, and you see in this Wordle, we rely very much on the community. And even though not everyone agrees on how to go about this, because as you know, Dr. Tempty said, there is no perfect way. We don't all agree about how to go about reopening our schools safely, but I really want to commend the community as a whole for the level of kindness and civility in the communications about the disagreements. I appreciate it. I learned something from every email that is sent, and I take them all very seriously, whether I'm receiving one email about a specific concern or a dozen emails about a specific concern. They're all read, they're all carefully considered, and they all become part of the discussion because this is something that we're reviewing daily. And that really gets to our last slide. We're 100% committed to creating the best possible plan, and that's experiences for our students and for our families, because we know how much the families are impacted right now. So we plan, we implement, we check on our impact, and we make adjustments. And that is going to be a cycle that we are doing continuously throughout the entire school year. Because, you know, I don't think that this is going to be something that's in our rear view mirror anytime soon, but I hope we're able to, as one of the parents put it in an email today, learn how to live in our new normal. And I think what I'm hearing from many of the professionals in the field is what that means is learning is making sure there's a lower viral count in the community before we take some of the really important next steps at getting our kids back in. So that is what I know for now. And I will now go to questions that people have for me.
Yeah, thanks, Dr. Bergstrom. Heather, anything for Dr. Bergstrom? Questions or comments?
Yeah, I do have a few questions. Thank you so much, Dr. Bergstrom. No doubt the amount of brain power and energy and time that you and your team have put into this is staggering. So thank you. I can't imagine a tougher year, whether you're year 1 in this role or year 20. Okay, I might be dense on this, but I guess I'm a little confused on the October 5th date. Are we planning to make the decision October 5th and then have a start date in the future? Or, yeah, it's a little unclear to me when we're doing it based on Dane County Public Health and they're going to let us know October 5th how that works.
Well, basically, we're planning to be able to increase starting the week of October 5th. And we'll know between now and then whether or not that's even possible. But
Gotcha.
we also
there's no date to know, like, okay, on September, making this up, 27th, we'll know that it's a go or a no-go.
Well, we'll tell people as soon as we hear.
Right.
I mean, we'll go, but as soon as we hear it's not, we'll alert people. Or if it's not, let's hope it is.
Yeah. Right. Okay. The other question that isn't clear to me is with the increase for K-2, for the phased restart, not Oregon Online,
right,
does the live teaching then go away because the teachers are now full-time with students?
Right. So we're in the middle of figuring that out. But right now we're leaning toward when the students are physically present in the classroom, emphasizing English or language arts, reading, writing, speaking and listening, and math during that time period. And then having the recorded sessions, the afternoon sessions, potentially with some of those terrific rotations classes, and then maybe science and social studies. But we're playing around with that right now. But we're thinking that the mornings when they're in person or the afternoons when they're in person, we'll probably focus more on reading, writing, and math.
Okay. And then I feel like a broken record, so forgive me, but and obviously our weather window is closing, but is there any, especially with the larger cohort and this younger age group, thought of moving some, all, any of this outside as it's able to be done?
Yes, as a matter of fact, I think some groups were outside today, and we've rented a couple of large tents that are outside. I know there are 2 outside of Prairie View, I believe, and you can certainly correct me on that.
Right.
But yes, that would absolutely be something we will utilize until we can no longer feasibly do it.
Okay. I think I'll stop there. I'll let everybody else have a chance, and then I might reserve the right to ask one follow-up question.
Okay.
You don't have to reserve the right. You'll get it. If you Anna, you're up. Kevin, then you're on deck. Anna.
Thanks, Steve. So Obviously, really great information. Thank you so much for this update and the hard work that you continue to put towards changing and modifying and revamping all of the planning and moving targets. So it's really tremendous to see the work. I will say that I do support following the guidance and recommendations of public health from the standpoint that they're the experts on infectious disease. And I don't think any school has ever had to develop a reopening plan through a pandemic. There's not a playbook, there's not a best practices guide. And so we're really stuck with following who we designate are the experts in this. And I think in this case, it's public health. So I think we need to lean on those experts, and we need to really rely on that expertise. I will say the school administrative team, certainly you are the experts on the logistics of how to run a school. So you know the ins and outs of how to get kids in and out of a school and what spaces we have to educate them in. So I think, we're relying on both of those technical experts to bring us to this reopening plan. So I want to just go on record saying I do support that approach. With that said, I guess another comment I would have is I do think it's important that we monitor how our other closest neighbors are doing with in-person learning. In particular, obviously, Evansville is our closest neighbor, and they are doing in-person learning. I don't know how accessible data is from districts on if they're having cases, if they're having quarantine issues. I don't know if that's public data or if it's available to districts to learn from, but I do think that there's value in looking at communities nearby that are not necessarily following Dane County public health measures, but might be successful with some in-person learning. I do think we should continue to understand that and learn from the experiences of our neighboring districts. I think it might be helpful to look at the potential of sharing that information with Dane County Public Health as well, to say, there are districts that are being successful that are outlying close neighbors to us. For example, we're kind of on the outskirts of Dane County. We're not as dense. So I think I'm hearing from people that it's difficult to compare our community, our Oregon community, to the greater urban part of Dane County. And so I hear that and I recognize that. And I think there's value in looking at that. Bottom line, I would like to see public health maybe reflect some of that in their guidance, because I do, again, support following those experts on the topic. So I guess the question for you would be, during those district superintendent meetings that you're participating in weekly or twice a week, if this is a discussion point that comes up about districts outside of the county that are facing this. And then I guess another follow-up would be, does Public Health of Dane County meet with Public Health of Rock County, for example? Are there meetings that are happening at that higher level with those experts with across counties? Because I think that's also could play into a revision or a plan or additional guidance coming from Dane County related to any of the experiences happening there. And those are really the comments that I jotted down related to my perspective on all of this at this point in time.
Thank you. And just to give you some information on your question, is that a lot of the superintendents in districts that are slightly more outlying the fringe of Dane County attend our meetings. So for instance, Lodi attends and Edgerton attends and Cambridge attends and Deerfield. So we have a lot of people who are consistently sharing their plans, and they are talking about bumps in the road that they hit or things that are going well. So that is something that we do as a superintendent group on a weekly basis.
Okay. Thank you.
Kevin and Troy, you're next.
Steve, just so I'm clear, is this really question time, or are we also making comments or reserving that to the end?
No, you can comment now. I'm just going through people once right now.
Okay. So I guess I'll echo what Anna and Heather said. Obviously, a lot of planning's gone in. I know you've we all have the common goal of getting kids back to school, right? I think what it really comes down to, from my perspective, is the metrics being used. I mean, from where I'm sitting, I think it's pretty unlikely we're going to get kids back to school if we're only going to use Dane County's mandate as our guide. It's obviously restrictive. I mean, as many examples as we can pull up of school districts or individual schools that have not maybe done well in the first couple of weeks, and it is early, I do understand that. Certainly examples, again, in an early stages can be found where, where they had a successful start with really going back, full time with masks, with social distancing, et cetera, within the constraints that they have. A couple questions, Leslie, to start. So what flexibility do we have in general to make decisions outside of PHMDC's advice?
Well, I think that
As a school district,
becomes a decision-making point, I think, for every school district. If the Supreme Court in their final decision says that public health doesn't have the legal authority to create an order, then it becomes a district decision for everybody in Dane County.
Right, but the individual schools could decide to go a slightly different direction, even though you're within Dane County.
School districts could, yes.
Okay, that's what I figured. I just wanted to verify that. I'm going to jump to a really specific question. So we prepared for K through 4 going back to school, and at the last minute with Emergency Order 9, we obviously had to go back to K2. As an initial step, what's preventing us from actually executing on the plan that was worked on so hard all summer leading up to school starting?
It really is just leaning in on the advice that it started as an order and became advice from public health regarding starting with K2 and then moving to the 3-5 phase. It really comes down to that.
Okay. Look, from my perspective, I understand why we have to take this seriously, right? It's a very difficult situation. We hope to never have to deal with it again once we get our way through the whole situation. I mean, what is really important for me is that there's choice for people. I totally respect all the parents and teachers that have situations where they're concerned for their health of family members that are at home, or just concerned in general that they have a full virtual option. But I think just as strongly, the parents like myself that feel very much aligned with much of the letters that were read tonight, maybe taking out some of the emotion, but much of the letters that were read tonight, that we're also given a choice to have our kids back in school, because our kids are not necessarily learning through virtual. And again, I know it's early, it's 2 weeks. I can tell it's a lot better than last year, which we all expect because we had much more time to prepare. But what I'm asking for, what I think is important to give our parents in our school district, is a choice. And those that want to stay virtual, they can stay virtual. I know we have that option for those that opted early in, but the more we can be on the leading edge in Dane County to take calculated, educated risk, the more that I think you'll have options for people. And I'll be proud of the district if we decide to err on the side of calculated risk, but moving ahead, briskly. I guess the last thing I'd say, I mean, we've talked about in the past, I mean, the long-term impact on some of the kids. I think the issues that we will be seeing and have seen with equity will only be exacerbated with the longer the kids are out of school. I'm hoping that, Dane County, with their metrics, obviously they've taken some consideration with factoring out the spike from UW, which is a unique situation, of course, with a different cohort of people that take their responsibility, I guess, differently, and are also, when you're talking dorms and that, pretty tightly contained. So there's some of that that's going to happen, and we should have all expected that. I'm sure the school to a certain degree did expect that, but hopefully the metrics will reflect the learnings that other counties, other states, other districts have had the opportunity to learn from in the early stages of this, and we're not paralyzed by some metrics that seem to lose credibility, at least in my eyes. So that's what I have to share.
Thanks, Kevin. Troy, and then Tim, you're next.
Well, I had a whole page of questions, but Dr. Bergstrom, you answered really most of them in your thorough presentation. I did just want to, I guess, back up to the starting point of your presentation where you talked about the attendance in the first week of school. And did I hear you right that the highest number of students district-wide that did not attend was 16?
Yeah, in the whole school. And out of the 16, only 11 of them watched the lesson later. So it's pretty amazing. I mean, I think honestly, the middle school ended up only having 3 students who didn't attend, and they were for the entire week. And there were really specific reasons for each child. And the numbers at the high school are equally incredible. Honestly,
Yeah.
it's better than the average year.
Yeah.
When kids are coming in person, so that's a fortunate thing.
Yeah, that's astounding.
Mm-hmm.
So no other questions from me. I guess I would just comment that I've been tracking this website. The National Education Association has the website of Wisconsin schools that have had COVID cases within the schools, and there's 61 schools on this list, not necessarily districts. Many of those schools have had to shut down or go to virtual learning. Not all, but many. And I would just comment that that's a very disruptive situation to put our students in when we have to react very quickly to go in-person learning to virtual learning. And but there's going to come a day when I think we're going to get to that situation where we're going to have to make those decisions. But I guess at this point, and looking at where we are with the number of cases in our county, I just feel like we're at a point where we're not quite ready to do a wholesale in-person learning for district-wide, and would agree with fellow board members' previous comments that relying on the health professionals, but also kind of looking to the future, as Kevin said, and just being open to some other possibilities as we go forward here. Because I do think it's going to be, if we simply rely on the health measures that are set out today, it's going to be a while at the current rate. So that's really all that I had.
Tim, and then Krista, you're next.
I really don't have any other questions either. I appreciate the knowing that we are considering how other districts outside of Dane County are doing. Because, I know that there was a questionnaire that went out to the districts across the state, for instance, and some 450 or 460 districts reported in, and 66, almost 67% of those kicked off school in person, only in person. And some of them are definitely facing some challenges. Janesville reported today, for instance, that 2 of their schools, they're going to quarantine 2 of their schools for 14 days, but they have 19 schools in Janesville. And so 17 of the 19 schools are continuing to at least hit their metrics and keep them open for in-person instruction. I totally agree with Kevin. We have done some amazing things in this district, and things like IEPs, individual plans for kids, and respecting their differences has been a great thing for our district. And I think we need to take that into consideration as we consider, those families and kids who need to or want to be in person, because I think we have educators who feel the same way. And I think we have a good match of families and kids who want to be in person and can choose that as a direction, not just for next week, but for the rest of the semester. And I hope that we take that into consideration. I know that Dane County has lots of metrics going on. They have lots of tracing going on. But the further we get out, again, 66% of the districts across the state are in person this week, educating their kids. And I'd like to make sure that we give our families that same choice, because we've always been a district that does that. That's it for me.
Krista.
Thanks. I'll echo what other board members have said in terms of the work that's gone into this. And, Leslie, as a superintendent in her first year, this is not easy. And I really appreciate you and how you handle this situation and your leadership. I think a couple things. I think we have to be careful about blanket statements that school districts are in session, but they're doing different things. And our district is different in terms of size than Evansville or other districts. And I think the important things that Leslie mentioned at the beginning are we have to consider space. We have to consider teachers. When we look at cohorts, we have to consider cleaning. So those are things that are unique factors to the Oregon school district. And so when we talk about going in person, I also want to make sure that we're clear that this is not pre-COVID in person, that things are going to be the way they've always been. And so it's important that expectations are set too, that it's going to be different no matter what kind of school we have for the next 3 months. And so, Leslie talked about kids being trained to wear masks all day. As parents and as family members, we can also start working with our kids in a positive way about preparing them for what this is going to be. We are school board members, but I'm also a mom. I've got a freshman in high school and I've got a sophomore at UW-Madison. So I'm really clear about what's happening with virtual, what's happening with a kid at college that's pretty much quarantined, and what that does to mental health. And so I really appreciate the Oregon School District reaching out to every family in our district, checking in on mental health. I can guarantee you 66% of the school districts in the state of Wisconsin are not doing that. So we deserve to pat ourselves on the back to being unique and forward thinking by doing that. And that's a really important thing, because that's a lot of what I hear when I talk with people that maybe are happy that we're not in session or not happy, is they're worried about the mental health of their kids. And our district has reached out to every family member. And I also had a meeting for Friends of Oregon School District this week about kids that have not checked in, the 16 kids, and we have staff people that are going to houses and checking on kids. Those are really important things that people need to hear about what our district is doing. Really, really important things. So I appreciate Troy's comment about it's also really disruptive to bring kids in and then to take them back home. So I think we're being prudent in making sure that we're going slow to go fast. And so I just think those are some really important things. The last thing I will say is, if we're being accused of being too safe, I will take that argument every single day as a school board member. That's it for me.
Leslie, a couple questions. When you've been talking in your sessions with mental health of Dane County, Madison, are they considering breaking out their data to take into account the UW-Madison surge?
Well, it's definitely was mentioned as something that they are considering. And I think that they will be holding on making a decision related to that to see the impact of the UW-Madison and the spread beyond the campus. But if the spread beyond the campus is minimal, then they said that that is something that's on consideration, would be pulling out the UW data.
Okay. And you talk with, I think probably weekly with the Dane County superintendents. Can you tell us whether or not they're following mental health recommendations? What are they doing?
Public health recommendations, yes. Right now, that is what everyone discussed last week, that the Supreme Court injunction made things more difficult, but didn't necessarily change the path forward.
For them right now.
That's correct.
Okay. You know, I want to echo Chris's comment that, we're in Dane County, we're 10 miles from Madison, so that impacts us. And, we have our own unique situation. So I don't want to get into considerations that other places around the state are open. That's relevant, it's not determinative. And I think, Leslie, we should continue to look at, how they're doing, the initial signs. I know Rock County I've talked with a couple districts down there, and they're really concerned about their metrics, and they're leaning on Rock County Public Health in terms of making their decisions. So, you guys know me over the years if there's been anyone who's pushed projects or action, as I'm usually the one that said go fast, and we're not going fast enough on stuff. I used to hear that from your predecessor all the time, Leslie. Slow down a little bit. Okay, so I'm usually the one pushing. I'm going to echo Krista's comment that, we're responsible for 4,000 kids and 600 employees. And we don't take that decision lightly. We're listening to everybody. We appreciate everybody's point of view, and we all have the same goal, that is to bring people back. But we're just learning about this disease. We're learning about its spread. We're learning about its short-term impacts. That is, what is the death rate? What's the mortality rate? Who is it affecting? And we're starting to learn about its long-term effect on people, including our students. And that means not only how sick are they initially, but are there any long-term implications in their health? That is, to their immunology system, to their heart, to their lungs, and to their brain. And right now, no one can tell us what those long-term effects are. And so I think our plan to start slowly and to maintain a safe level is the appropriate one, with built-in flexibility to modify that as we go, to learn from best practices. But I don't want to get into a situation where we've blown up the district with a spread of this disease and blown up our community like we've seen at the UW and other campuses around the state, not knowing what the long-term effects are on our students and our employees and on our community. And I don't want to have a situation where we keep seesawing back and forth between instructional models. We have planned all summer long for this eventuality, primarily dedicated to let's deliver online at the beginning and see how we can phase off of that. There is no reason to jump off of that at this point in time. Okay? It doesn't mean that we're not committed to moving forward as fast as possible, but that will be determined as we go forward. Okay? But for me, it's about, I don't know all the facts, we will learn them, and let's be committed to safety, and let's do what we're doing right now the best way we can, okay? And we plan for that all summer. And the anecdotal returns right now is that the instructional level virtually is really very good, and we'll see, the proof is going to be in the pudding. We got to keep monitoring that over the next couple of weeks. We got to keep monitoring the data in terms of health data and the spread, so that we can move eventually towards reopening. Okay, but that's where I'm coming from. But I'd like to commend the board and to the community for being able to express differing points of view on this, because they're all relevant. And for the most part, they've all been delivered in a manner that's been kind and caring, and recognizing that we're all part of a family in a very difficult situation. And we hope that people understand that we're listening and they're being heard as we move forward. So that's my input. Heather, you said you might have another give back.
Yeah, the only reason I wasn't sure if we were questioning or commenting, and I did the questioning. So I just have a very brief comment. And I guess where I'm at is, yes, we need to listen to Dane County Public Health, and the numbers matter. I also so badly want school to open, like many other people have said. I also want us to go slow because I already am nervous as a parent that as we expand K through 2, if it doesn't work, then we have to go backwards. And I think kids are resilient, but I've just seen such a difference this year, speaking as a mom, starting the school year with the expectation that it was going to be online. And yes, you'd have 1 day a week in school, and kids can understand that. It was way different than last spring when we had to yank them out. But I think I dread the idea of coming back and saying, okay, now you can go 4 days, and in a few weeks now, maybe 2 or 1. My other comment is, I'd love to go slow to go fast. I just think it's hard to make a decision before we've even had a full week of cohort to react to. So I think that while we're all in a push to do this safely, Dane County aside, I'd like to see how the next week or 2 weeks go in our own school district, in our own schools with our own teachers and kids before we can even, say, okay, let's expand. I love the idea of planning to expand. I think that, we need to have that in place. It just makes me nervous that if Dane County said next week, okay, it's a go, that we haven't even figured out our own process before we're now, K through 2 making a huge jump, and then hopefully, 3 through 5 and 6 through 12 to follow. So that it's like stepping on the gas and stepping on the brake at the same time. But yeah, that was the one thing that made me a little nervous, was just before we've done it ourselves to make this pretty big shift. So thank you.
Leslie, I think kind of one of the common themes that you've heard from the board is that we want to be checking in on a regular basis, on the decision, monitoring the data, understanding what data is being used. So I'm going to continue to contact board members. If we have to schedule a special meeting just for an update and that sort of stuff, we will, board members, to do that. We have our annual meeting in 2 weeks. For sure, we're going to have a meeting after that. And then the number one agenda item for that will be to update all of you in terms of where we're at on the progress, because it's not a static plan. We're going to progress through it. So, okay. That will wrap up that item on the agenda. Annual meeting update, Leslie?
Just that it is next week, and excuse me, our next board meeting, not next week. So that would make it the 28th, and that we will be having it at the Commons in the high school so that we can ensure we are all properly spread out.
Great. Superintendent's report.
Well, the fun thing that I have, because I think I've certainly spoken enough. So the only thing that I really, really wanted to add today was that today was the first day that we had our K2 students in the buildings. And it was absolutely wonderful to see. And we took some great pictures. And what was interesting about the picture is that you can look at it from 2 different points of view. When there were just 4 kids in a classroom spread apart and the teacher was way up at the front, I looked at it and, I felt a little bit sad that, wow, this is what school looks like right now. And that was a little hard for me. But then one of my colleagues looked at it and said, oh, this looks really safe. I feel so much better just seeing this picture. So I think it's important for us to know that we're all looking at the same picture and coming up sometimes with some very different conclusions, even when we're all trying to accomplish the same exact thing. But it was a really fun first day to see them, and I can't wait for tomorrow and we get to see more of them. And everybody, we opened a new school, and that in the midst of a pandemic is oftentimes getting lost. This beautiful new school that our students were able to visit today, or to actually spend a whole afternoon in. And I was able, Andy and I and Carrie Majeski were able to give some a tour after our students and staff had left, so that some people from the city of Fitchburg saw the school. And one of the things that was really cool is as we were standing there talking about the school forest that is right behind the school, mom and baby deer just walked right across our viewing and across the hill so that everybody was able to take a look. And it was just lovely to be able to show people this learning space we have for our students, that our students were actually there today, makes it even better. So just wanted to make sure everybody remembered we opened a new school, everybody, and it's pretty awesome. Many thanks to Carrie Majeski, and then to Andy Weiland and Zane Heights for all the work that they did to get all these things going, make it happen.
Thanks, Leslie.
Superintendent's report tonight.
Good. Closing future agenda. Well, we've got the annual meeting in 2 weeks, and we'll have an agenda on opening of school issues and the continuing discussion. And I think we'll probably again try to put the closed session on then, because we're late again tonight with stuff. So probably that. I think I'm about done with zoomed out. I'm seeing a lot of head nods with okay.
About my evaluation, it'd be best if it's probably not 9:30 at night. So that's a good thing for me. I'm fine with that.
Yeah. Okay. So that's the agenda. Anybody have anything else on that? Tim and Kevin and Heather, I'm going to reach out to you about scheduling, for our ad hoc committee so that we can start working on that. I think we got to get going on that because I think we have the closing.
We do. We do. I think the week of the 21st.
Okay. So that'll give us time. So I'll reach out to you guys. Okay. Checkout. I'm going to go through my tile. Heather, you're in my top left. Anything?
I'm good. Thank you.
Yeah. Krista, you're next.
Yeah, I just have a couple things if you'll indulge me. I usually take this time once in a while to give people an update on Friends of Oregon School District because it's school district related. So I just wanted to update people on a couple things. Number one is, if people recall last year, Schools of Hope no longer exists in our school district. And so Friends of Oregon School District started a pilot mentor program at RCI last year. And Steve, you were a mentor. Leslie, you were. Tim, you were. So with COVID, it kind of got a little derailed, but we had a meeting and we are starting that back up again. So we're going to be reaching out to the current mentors that we had, as well as a new group of people to start that up, to maybe meet virtually or one-on-one with students, because we know that's a really important thing, and expand that to 4th grade and Forest Edge. So if people are interested in being a mentor, please let me know. And then we'll be kind of contacting people in the community to do that again this year. Second is we met with John, Tanner, and Andy about internet access. That we do know in our school district, we have students who, especially now with virtual learning, either don't live in an area where they can get a service provider access. They need a MiFi, or they live in an area that does have internet service, but they are not able to afford that provider service. So we have launched Connecting Oregon Kids, which is raising money to get 50 students in our district access to internet, because we think that's very important, whether we're in a virtual environment or not. And so our goal was $20,000 by the end of September, and we are already 3/4 of the way there from donations from our community, including a $5,000 donation from Oregon Community Bank. So just wanted to thank the community and let people know about those two initiatives that are working in partnership with our school district.
Thanks, Krista. Tim, you.
Nothing additional from me, Steve.
Hey, I'm looking through. Troy, you're over on my left.
Nothing from me tonight.
Kevin, back from Utah.
Yeah, I'm good. Just want to thank all the teachers and administrators for the strong start to the year. And we know how challenging it's been. And we know ultimately everyone on this call and everyone in the district has the same goal in mind. So thanks for everything you do.
Anna.
Just a quick story. My kiddos both had orthodontist appointments today during their math class. And so they missed class, but they got home, or at the end of the school day by noon, they checked in, they were on the video, they were watching it and getting all the stuff they needed figured out. So they didn't really miss math class. They got to just watch the video and do their math, and it worked perfectly. So what a great way for kids to be able to stay connected when they have things like orthodontist or dentist appointments, and they don't have to feel like they're left behind. So it was awesome. Thanks.
Yep. And I don't have anything. So that means one more motion for the evening.
I'll move
Nobody
to
wants-
adjourn. It's Krista.
Is there a second?
This is Heather. I'll second.
Yeah, roll.
Ms. Flanagan,
Yes.
Ms. Garrison,
Yes.
Mr. Maring,
Yes.
Mr. Pinkratz,
Yes.
Ms. Bijak,
Yes.
Mr. LeBrun,
Yes.
Mr. Zach.
Yes, we're adjourned at 9:16. Be safe, everyone. Thanks.